have a 13 on your side follow-up this morning. Just weeks ago, we reported a growing number of Lyme disease cases in Kent County caused by tick bites. In 2016 through 2020, Kent County only saw 11 cases. But in 2025, data going through September of that year shows 216 cases were reported. Trinity Health doctors say the type of ticks moving through right now could be the culprit, and they're moving because of climate change. And as we get warmer here in West Michigan, it is important to know what to look out for when it comes to Lyme disease. Joining us live this morning is Dr. Joel Kammeyer, the Division Chief of Infectious Diseases at Wayne State University, to talk about what people should know before you head out this spring and summer. We appreciate your time, Doctor. Thank you so much for joining us. Let's first start off with Lyme disease. This is something every Michigander should be especially thinking about. Why is that this time of year?
Thank you for having me. So May is Lyme Disease Awareness Month, and the timing is really deliberate because we're right at the start of tick season. Michigan's tick season runs from March through September, but really it's the months of May through July that are the hot spots. And as you point out, ticks really are becoming increasingly common in populated areas like Western Michigan. So the goal of the Awareness Month is to get people to thinking about prevention and early recognition before they get a bite, not afterwards.
You know, if with your research and studies here and also just your experience as a doctor in this field of infectious diseases, who should be most concerned when it comes to tick bites or Lyme disease in general?
Sure. So CDC surveillance data shows that children from ages 5 to 9, as well as older adults, particularly kind of in the 55 to 60 age group, are a little bit more at risk. But really, practically speaking, anyone who spends time outdoors in Michigan is at risk. So hikers, gardeners, parents watching their kids play in the yards, pet owners. Ticks are most often found in tall grass and wooded areas. But even now we're seeing suburban lawns and parks sometimes carry ticks that can place people at risk as well.
What can we do after we discover maybe a tick on our body or something like that? How quickly do we need to act to be able to lower the risk of infection, or is there anything we can do at that point?
Absolutely. So prevention, in fact, is extremely effective. So if there is a tick, then the most proper response would be to first remove it promptly, use some fine-tipped tweezers, grasp it close to the skin, pull upwards with steady pressure. If you're out hiking, wear long sleeves, tuck your pants into your socks. If you're on trails, stay on trails that are cleared. And I think most importantly, it's important to perform a full-body tick check after spending time outdoors. Ticks need to be attached for 36 to 48 hours before they can cause Lyme disease. And so there really is a window of opportunity to identify a tick, remove it with tweezers, and to hopefully prevent Lyme disease in that manner.
Yeah, so what are the signs and symptoms? And then if we get Lyme disease, what are the long-term impacts of it?
Classically, when we think about Lyme disease, we talk about a rash, and the medical term for this is erythema migrans. It classically looks like a bullseye, and when you notice it, it's very characteristic. Part of the challenge, though, is that it's not always noticed. There are times in which patients don't notice the rash, and in fact, not everyone develops the rash. In the period of time after the fact, symptoms can in fact mimic the flu a little bit: fever, fatigue, muscle aches, headaches. And yet, if it's identified early, it's quite treatable. In patients in whom the diagnosis is delayed or poorly coordinated, then that's when the infection can affect the nervous system, the hearts, the joints, and some other symptoms as well.
Okay, so that's some good insight there. Are there any other diseases that ticks can carry with them that people may want to look out for? Maybe, I know this is Lyme Disease Awareness Month, but I think it's important for everyone to know kind of what the other risks might be of getting bit by a tick are.
Yeah, that's an excellent question. And I would frame this as follows. In the state of Michigan, as you had pointed out, there has been a significant increase in Lyme disease cases that are sort of endemic to Michigan. classically, the tick that carries Lyme disease has been mostly found in the northeastern United States, as well as pockets of Wisconsin and Minnesota in particular. And so there are other diseases that can kind of mimic Lyme disease that really are associated with travel. Diseases such as anaplasmosis, ehrlichiosis. Really, though, I think that those are in patients that have traveled to other places and that have come back to Michigan that would be of more concern.
Okay. And I'm just curious, too, are there other misconceptions that you hear about Lyme disease or maybe ticks and the disease they cause that you hear that you might want to clear up with people watching at home right now?
I think that one of the challenges with Lyme disease is that in patients in whom diagnosis is delayed, there are patients that do struggle with longer term symptoms for months or even years, can really kind of struggle with the fatigue, the muscle aches, the joint pain. And this is an area that is still actively being studied to try and address, how some of those patients who have some of those more prolonged symptoms, what treatments that we can offer them. Certainly, the most important factor is prevention. And in patients that do have a tick, noticing it early, removing the tick, and if we do see characteristic symptoms in those early stages, we really want to get on treatments early because in the early stages, it's very treatable.
All right, Dr. Joel Kammeier with Wayne State University. We appreciate your insight and your perspective on this. Thank you so much.
Thank you for having me.